Hello and welcome back to the channel. My name's Ed Hope, a junior doctor in the UK, and today we're going to be breaking down certainly my favourite Christmas movie in how many times does Die Hard die in Die Hard.
Welcome to the party, pal!
Now there are a few instances where he wouldn't die but certainly would be injured, so we'll also have a taking some damage counter as well as a Die Hard counter. And stick around to the end where we'll talk about the real thing that would likely kill Die Hard.
After you get where you're going, take off your shoes and your socks. Then you walk around on the rug barefoot and make fists with your toes.
Fists with your toes.
The guy next to him on the plane gives him the secret to surviving air travel, which we go on to see Die Hard taking his advice later on.
Son of a bitch.
It's not stated, but it feels to me that he's talking about the prevention of venous thromboembolism. So immobility is a risk factor for blood clots to form in your legs, which can be problems on themselves, but what we really worry about is if they embolize, meaning they can travel through the blood system and end up somewhere else, causing damage. Most concerning would be if this ended up in the lung, causing a pulmonary embolism, which can be fatal. The rates for a PE on a flight longer than 4 hours, that's around about the time from Chicago to LA, is around 1 in 4,656, so pretty uncommon, but as we said, they can be fatal, so even with treatment in around 8% of the time. And firstly, poor advice from this guy. You should be moving your feet around on a flight before the clot forms rather than afterwards, but he'll probably be fine given how rare it is, so we'll let him off.
And make fists with your toes.
Brucey gets involved in his first major scuffle, getting slammed through some fairly flimsy looking metal bars, probably just some bruising, maybe even a laceration, which could be pretty nasty. There doesn't appear to be enough impact to break a rib here. But then we see his head get slammed hard into a wall 3 times. At first I thought it was a sort of soft false wall, but it seems to be quite hard at the end of the shot. Could easily cause a concussion or a contusion, so a bruise to the brain, and possibly even an intracranial bleed. Most concerning would be something like an extradural hematoma, where the blood is on the outside of the linings of the brain, and as it increases inside with the bleeding, it starts compressing the brain and ultimately can be fatal by forcing the brain out of the bottom of the skull, what we call brain herniation. He'd have to be pretty unlucky for this particular thing to happen given the mechanism, but it's still a death avoided. Having survived some fairly nasty head trauma, we then see a roll down a metal staircase. This is a classic thing we see in the emergency department, not usually from a fight, but rather from people just tripping. And this is a significant traumatic event. The other guy has died instantly from it. So Die Hard would need a full trauma assessment for this fall, as he could have multiple injuries, including to the skull, spine, rib fractures, and damage to the underlying organs of the heart and lungs, and limb fractures, all of which can cause problems on their own, but we could also be dealing with lots of bleeding, particularly with multiple injuries. This will be compounded. With all trauma patients, we'd assume the worst and take no chances, so we'd immobilize him with a collar and blocks and on a spinal board to protect that spine, and focus on his airway, his breathing, and his circulation. As we said, we could be looking at lung injuries like pneumothorax, so collapsed lung or significant hemorrhage. And once he's stable, we'd do a CT scan for a definitive diagnosis. Since the dude next to him died, this is definitely another coffin dodged. Our hero now falls down an elevator shaft, and this is certain death. Although in the film he catches a ledge with his fingertips, but presumably this is a brief hallucination as he dies in a mess at the bottom of the elevator shaft. There is an explosion in the lift from the C4, which he stops to admire before diving out the way as the fireball comes flying past. He gets pretty caught up in the flames and has not much protection, so he could have significant burns to his body. Bad, but likely not fatal with treatment. He may also experience some blast injuries, so primary blast injuries from the air pressure change could perforate his eardrum, or secondary blast injury, so shrapnel from the explosion could enter the body. Most concerning would be if that gets into the face or eyes, and tertiary blast injuries from being thrown and landing awkwardly. He gets thrown in the blast here, but let's assume he's landed all right.
Roy, you all right?
Just trying to fire down a 1,000-year-old Twinkie.
He then has a snack on a 1,000-year-old Twinkie. Clearly, it's not really that old, but of all the things that I thought could have killed him, I didn't have food poisoning on the list. He definitely takes a bit of damage for that, even if it's just some loose stools for the next couple of days.
Shoot the glass. Jesus Christ!
This one really made me wince as Bruce gets some deep lacerations to the feet with clear bleeding akin to a night out on a dance floor in strappy shoes. He does pretty well to get to the bathroom where he does some basic first aid by picking the glass out and washing his feet with running water. He then dresses the lacerations with a makeshift bandage, which will hopefully encourage a clot to form and prevent further dirt getting into the wound. In the emergency department, we'd have to explore that wound carefully, wash it out thoroughly, and use x-rays to rule out any foreign bodies that might be left in the wound before we then close it up with stitches. Then we'd make sure he's up to date with his tetanus vaccines, and as these are large lacerations and a pretty dirty environment, we'd give him some prophylactic antibiotics too to reduce the risk of wound infection. He is clearly in a lot of pain from this as he spends the rest of the movie limping, although does seem to be limping on the wrong foot sometimes. Not life-threatening, but definitely more damage. Another big old scrap and no more limping as he's full of adrenaline, fighting for his life. His body is ignoring his pain signals. He would likely have a few broken bones in his hands here, most commonly metacarpal fractures, so breaking the bone up to the knuckle, often referred to as a boxer's fracture, as it can occur when you punch something solid like a bad guy's face. He then gets a real bad kicking, most likely broken ribs, which on their own generally aren't a problem unless multiple ribs are fractured, but we really worry about damage to the lung underneath. And added to that, he gets kicked in the face, and this could easily kill him from a traumatic brain injury, either direct damage to the brain or a bleed around the brain, and would expect some facial bone fractures too, so nasal bone, the zygomaxillary complex, so your cheek, your mandible, or a fracture of the eye socket, all of which very common injuries in assault. So again, he is dicing with death here. After the many attempts to shoot him, Die Hard finally takes a gunshot wound to the back of the right shoulder, and we see some blood splatter from the exit wound. Later on, he's able to move his shoulders in that epic scene, so maybe this is just a glancing blow to the shoulder, so just through the skin and soft tissue. As any deeper injury, we'd be looking at fractures of the scapula, the humerus, or the clavicle, all of which we'd be expecting limit in his function. As with all gunshot wounds, we also need to think about bleeding, and the main artery to the arm comes from the subclavian artery and turns into the axillary artery. Thankfully, this is a lot deeper and tucked away under the armpit, so he should be okay. that this has been avoided. For any gunshot wound, we also have to be very wary of the bullet track, as it can change when it goes into the body, or fragments from the bullets can go elsewhere. So maybe the shoulder injury isn't going to be fatal, but anything that goes into the thoracic cavity, we have our lung and bigger blood vessels that, if damaged, could easily be fatal and extremely quickly. So it's yet another date with the Grim Reaper cancelled. And then we see the worst injury of them all, certainly from the underhanded tactic department, where Carl pulls John McClane's hair. Very mild damage, although we do see in later movies he hasn't got a lot of hair left, so that's not going to work nowadays, guys. And judging by his reaction, it certainly stings a bit. Now, John McClane jumps off the side of a building with a fire hose as a bungee cord. Okay, it does work out in the movie, but this would almost certainly kill you from equipment failure, leading to a death from a fall. Hoses, great for fires. Bungee cord, better for bungee jumping. And you really got to learn the difference. Best case scenario, given this force, he would probably fracture his spine, severing his spinal cord at around the level of T6 and T8. And at this level, it wouldn't kill you, but it would lead to paralysis of the legs. Not fatal, but a very life-changing injury. But let's face it, given all the bullets he's literally dodged today, jumping off a building like this is really riding your luck. In reality, he'd be a goner. And finally, the biggest killer in Die Hard.
Yeah, I'm still here. Way ahead of you, partner.
Smoking.
I'm a cop from New York.
Now, this event takes place over a single evening, but he smokes 6 cigarettes. Maybe he's under a little bit more stress than usual and using it as a coping mechanism, but taking this at face value, he probably smokes 15 to 20 a day, which would be doing more damage to him over his life than any of these bad guys. And this would be affecting his whole body. In his brain, can cause strokes and vascular dementia, tongue and throat cancer, chronic lung disease and lung cancer, heart disease, gastrointestinal cancers, bladder cancers, can cause peripheral vascular disease, and even erectile dysfunction too. So cigarettes are the real villain of the film, and this is probably what will kill him in the end. So counting all these up, he would have taken 4 scenes of damage and would have die-harded 7 times, including 1 smoking related death later down the line.
Yippee-ki-yay, mother.
Also, a shout out to the real diehard of the film, Carl, who has the emotional hit of his brother dying, who then takes a heavy beating to the head, gets hanged, is in the middle of an explosion, and then takes about 5 bullets to the chest before going down. But no one ever talks about Carl.
God, that man looks really pissed.
So there you have it. I hope you enjoyed my look at this one. If you did, then please give this video a like and drop me a comment if there are other scenes from TV and movies you want me to check out. I've been working my way through the best fight scenes in the business, breaking down the injuries, so why don't you check out one of those videos too? And it just leaves me to say, have a super Christmas, whatever you're doing, and I'll see you all soon.